Hey, everybody. Hey, Ansel Lee here today with, another edition of Ansel Lee Live. And hey, thanks for joining us today. Very excited about our guest that has joined us today. I've got Jennifer McNamara here today, the CEO of Healthcare Inspired. And hey, Jennifer, how are you?
I'm doing great, Ansel. How are you? It's nice to see you again.
Yeah, great to see you. And hey, we got what's so cool is that I really ran across you here on LinkedIn and saw all these letters behind your name, and I was like, wow, that's like that long of letters, and I realized there's certifications and cutting certifications and whatnot. Um, and so, as a matter of fact, actually, I think Jeff Beecher mentioned it as well. And so and then we got to make contact. We got to chat, and then we got to meet at the Ledger Building up in Bentonville here a few weeks ago. So what a pleasure.
Yes, I love the Ledger. It's one of the coolest places I think around. And I've lived in the area a long time, and when they started building that thing in downtown Bentonville, I was just like, wow, this is going to be something cool. So it was a pleasure to meet you there and get my airship coffee. It was great.
Airship coffee and man, let me just also take off on the Ledger Building as well. We pulled up for a meeting down there with the fuel folks, the innovation group, and we pulled up to the front of that, and I was like, oh my gosh, I had no idea this is what this was, and it's so impressive, and I'm like, this shouldn't be in Arkansas.
Somewhere better. No. I'm telling you, this community in Northwest Arkansas is where it's at. There's just so much alive, networking here. It's a great place to live and work and play, and it's great.
I believe it, and we've been spending a lot of time ourselves. Ansel Four and I have been up there, and of course, we've had our team, and we work closely with the fuel innovation program. So really great to have you on here. Hey, give us a little thumbnail on who you are, a little bit of your background, if you would.
Absolutely. No, I just love the healthcare industry. I got into this 20 years ago, right out of high school, actually. I was, family influence in the industry, and I didn't want to go into the clinical side. There were some reasons why I don't want to do that. And so I went into the business side, and I wanted to help people in some way, right? And I learned quickly how intricate this business is, and I didn't learn it overnight, but as I gradually learned the benefits of what I do and how it actually helps people, it helps track disease trends. We're basically in the business of tracking data is what we're doing as medical coders and billers. And so it's an important job that we do. And as I grew, of course, the letters behind my name all have to do with different roles I've had in the industry: auditing, risk adjustment. There's also a compliance element to every piece of that. And then I have some specialty ones as well. I've spent some time in orthopedics, general surgery, and ophthalmology, which are the last ones you see there in my alphabet soup. So
I gotcha. Well, and that's important today. And I think one of the we've talked about this, but really, and what I've seen with my clients is the scarcity of medical coders and medical coders that know what they're doing. And are you seeing that as you're developing your business?
Oh, 100%. And it doesn't matter where you go, what hospital you work for. If you work for a private clinic, there is the need for training, and the word education and training sometimes becomes a negative term because it means it's going to cost me money. And so there's always a cost to it. And so people kind of shy away from it. But it's so important because I've seen so many unnecessary errors in billing and coding that not only affect a physician practice being profitable, but also the patient is affected. When it's not coded right, it prevents them from getting services they need. Like if they need a prior authorization for a really major surgery, what is documented and what has been coded previously has a lot to do with how they can get access to future care.
Well, and that was kind of the onus of what really piqued my interest in what you're doing is that I'm working with a client that really has explained to me. And by the way, we've got some folks here. I want to say hello to Keith. Hey, Keith, how you doing? And Abdul, good to have you on here. Sydney, thank you for your kind words. Hey, that, one of the things that I'm working with a group that as we're looking at, because we're working with a solution to look at, going after those underpaid claims, a software, an AI solution.
Yes.
And, and the CEO said, look, Ansel, our problem is more upstream. Mm-hmm. And when he says more upstream, I know he means, on the coding side of things.
Yes.
And you've got to get that right, because it is such a game on the insurance side. Any reason for them to reject the claim or put it in a hold status, I mean, it just drags out reimbursement, and getting it right on the front end is such a big deal. And that's why I see such a value in what you're doing. Would you agree?
Absolutely. We are an ever evolving and changing industry. I've been doing this, like I said, 20 years. I've been on the other side where we just had paper charts and pulling those charts every day and filing things right. But now we were in this electronic world. There's an added level of risk, with all the things that we do, because there's a lot of room for error in electronic data, because you can copy and paste. You can do things that are just a little bit different. You can tweak things, but it also has benefits. Like, it can make us more efficient if we use it correctly. And so a lot of the things that we can do to be more efficient, people aren't doing. And it's obvious they're not doing it by all the errors that we see. So there's a lot of room for improvement.
Well, one of the truisms that I have found in being in this business for 35 years plus is that when you install a system, you think a system's going to go and help you solve a problem. What I find is when you install when you install a new system, it actually magnifies the problem. It actually draws attention to the issue. And so, having good, a good coding, actually, we talked, and you and I've talked a little bit about this, having a good coding solution. Because there's some AI out there right now that, and you and I talked about a few of these, that would help in their coding situation.
Yes, there's some great products out there that I really love to use. And a lot of it has to do with the fact we can't just automatically think that it's going to code it for us, and that's the end of the day. It's going to go outright and get paid like snap like that. Like unfortunately, some products out there promise these things. But there are so many intricacies. So what our goal is, at least right now, what I feel the goal should be is really just to make it more efficient. So make it to where it can do a lot of the thinking up front, just to kind of give us the baseline. And then we'll use our trained brains to identify which code is more appropriate based on what the data is showing. And then we still have to make those decisions. We have to click a button, or we have to send that information off somewhere else to maybe a billing system. And maybe we can integrate. And there's a lot of potential, I would say maybe 5-10 years down the road, as we learn more about this. And in healthcare, it's becoming, more common on our side to really push this, because, practices are losing money. They're short-staffed. Physicians, there are not enough physicians in some specialties to even keep up with the workload. So they outsource to other countries sometimes that, unfortunately, sometimes they don't understand the intricacies of the United States billing processes, and don't really have a good grasp like those of us that live here do, because we know the doctors, we know what they're going through, and we're in the clinic. So we're kind of seeing this. It's a lot easier to understand the US healthcare system if you live here. But at the same time, it's sometimes a need to have the help, outside help, if you really need that volume touched. And so AI technology can help with the volume, in many areas, but we want to be careful. We don't want to just let it control us. We want to be able to control and let it learn, right? And you have to teach these systems how to learn appropriately.
Yeah. So, I mean, you've touched on we've kind of talked broadly, but specifically, you go in and can do really can do a coding audit on these groups and specialties. And can you talk a little bit about what you do there and and how it helps?
Well, initially as a baseline, I don't like to jump right into a full audit because sometimes that also screams cost money. So what I say is let's do a data assessment. So and a lot of us that have been coding a long time, those on my team and the consultants I work with, we can quickly identify from your report of 6 months to a year of data, the main codes that you basically deal with. And we can identify rather quickly if a combination of codes is used that is completely inappropriate. Like we know all of the rules and policies from like Medicare and other payers. We can tell you right away, this is not right, this is not right. And then we can create tools and, and systems to quickly find that data and isolate it. So it's kind of like a nice interface for you to kind of search which code sets are we really not doing right, which are good, and then how much money are we making versus losing by certain code combinations that we're looking at. So there's a lot of potential for data reviews before we even get to a full audit. That way, you're not wasting your time, right? Like we can identify these elements, do a education session maybe, and then we can do a full audit based on that data.
So really, step one really is to do a data review.
Yes, absolutely.
And so you can take a look at their data and really give them some feedback. Just really you can glance over it pretty quick and see and kind of see where they could improve.
Yes, 100%. That's our goal, is to see where those leaks are, those revenue leaks are. We don't need to teach you the kitchen sink of topics. We can just isolate the important facts, see how you're doing in 6 months. Once we've implemented an education program, we'll check it again and see how that works. And we'll compare that to the baseline data we've taken previously and then move forward, however increments, however you want. We can set it up to your needs basically. And then we can pull 5-10 charts. When we do an audit, normally we recommend 10 charts per physician because it's a more of a true to life, data that shows really where you're sitting percentage wise, what your risk is.
Right.
It's really what audits do. They test the risk you are facing for compliance. So if you get a payer audit, you're in a better position to pass it.
Gotcha. And just as we're coming in on time here, you were talking about a couple of conferences that you're heading to that would really help our community.
Yes. So I will be attending the NAMUS, which is of course National Association of Auditors in Charleston, South Carolina, December 7th and 8th. And I'll be speaking on revenue integrity alongside Christine Hall. And it's really about finding those revenue leaks and collaboration with your teams, getting a revenue integrity department set up in your facility to where everyone knows what each other does. They can help each other, but the goal is the revenue stays intact and the integrity is there.
Fantastic. So, what's the best way for folks to find you? And
our website is healthcareinspiredllc.com, and I'm all over social media. We have, of course, HLTH Inspired is our tag for Twitter or X now. We have a YouTube channel. We have Instagram, Facebook. It's all over. So you name it, we're on it.
Oh, I know you are, and I'm impressed with what you've built. And hey, I just want to say, hey, great job, keep going. And really, I just wanted to shine a light today on really some of the services that you guys provide and what a benefit that would be to our community. They can also find you with a direct message here on LinkedIn.
Yes.
And if you can't find Jennifer, you can message me, and I'm happy to connect you with her. Hey, any last thing you'd like to share real quick before we sign off?
Well, it was a pleasure being on here with you, Ansel, and I really enjoyed meeting you and your team, a while back. And I'm looking forward to, kind of keeping up with what you guys are up to. Let's stay profitable. Let's stay compliant. Let's focus on patient care, because if we focus on the patient, I promise you the revenue will come if we just focus on staying compliant and taking care of our patients. It's the goal.
Well said. And I couldn't say it better. And that's a great place. And let's continue our conversation.
Yes, absolutely. Thank you, everyone. Nice to see you today.
Oh, thank you, Jennifer. And thanks everybody. And we'll be back soon. More later.